I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
The IDD Health Matters podcast is a joint production between Friends for Life and Intellect Ability. For more information, go down into the show notes and click the link where it says Learn More here.
Hello, and welcome to this episode of IDD Health Matters. I have a great guest today, Dr. Michelle Catanzarite. Welcome, Michelle.
Thank you. Glad to be here.
So, we first met, it was quite a while ago. We both spoke at a kind of a summit about what we were doing in the field of healthcare for people with intellectual and developmental disabilities. I bet a lot's changed since we did this back whenever it was.
Brand new then. I've learned a lot, and a few things have changed too.
All right. Well, tell us how you got into this field and about the work that you do now.
Yeah. So I'm the Chief Medical Officer at Achievable Health, which the name is new too, is a federally qualified health center in Culver City, California, that focuses on caring for people with intellectual and developmental disabilities. And I got there by accident.
That happens to a lot of us. I fell into this field too by accident.
Yeah, I had moved to California, was looking for a job and interviewed for this position and heard about the mission to care for people with intellectual and developmental disabilities and thought, oh, this is brilliant. This is, I had no background in doing this work, but I just immediately thought of people who I had cared for in the health center I worked at in Ohio who I could never examine on an exam table, or I didn't feel quite equipped to know exactly what to do. And so having the ability to focus on that and create a welcoming space seemed like, oh, this is brilliant, and I really want to be a part of this.
So did you feel totally prepared to do this when you started in the field?
Yeah.
That again, that's the other common story with most of us healthcare providers, is that we really don't get the training that we should have in providing healthcare for people with IDD.
Exactly.
Yeah. So tell us about the journey from when you started.
Yeah. So I was lucky to have some really good mentors who had been there before me to help me understand kind of the basics of how to care for people with intellectual and developmental disabilities. And truly, it's not different. The medicine obviously is the same. Communication is different. And so I think it takes more of a mindset shift than actual training to be able to do this work.
You nailed it. That's I talk about that a lot. It's not new medical conditions.
Right.
You treat them the same way. It's the different presentations, the different way people who maybe don't use words to communicate, the different ways that they still do communicate those things, and ensuring that we as clinicians have an understanding of what is communication, and not just, oh, this is just something that people with IDD do. We call that diagnostic overshadowing, where we just, attribute some behavior to, oh, that's just what they do. Let's put them on a medicine to stop it. And then people get put on medicines that they don't need to be on. And then there are other complications. And the whole time they may have just had a toothache, or they may have been constipated,
right,
and nobody bothered to think about it.
Yeah.
So it's that framing of how to approach it.
Yeah, I think that it's humility, it's listening, it's trusting the people who are communicating with you, whether it's verbally or non-verbally, or the caregiver.
Or the supporters as well too.
I think it's all of those things really contribute so much, which is what makes it fun.
Yeah. It's interesting for sure, isn't it? Yeah. So tell me more about the clinic itself. What's it like? I know you said it's a federally qualified health center. I used to work at one of those too when I first started in my career, so I'm familiar with those.
Yep.
But tell us more about the clinic, maybe how it's set up, how the types of patients that you have.
Yep. So we're a pretty small health center now, but looking to expand, which is really exciting. So we have 6 exam rooms. We have, for medical care, we have integrated behavioral health. So we have a couple of social workers who provide therapy for people with intellectual disabilities and the rest of the community. So we don't just serve people with intellectual and developmental disabilities. Part of that federally qualified health center structure means we see everyone, but we're co-located with a regional center, which is social service center in California for people with disabilities.
And regional centers, just so everybody to know, have a different meaning in California than they do everywhere else.
Like many things.
Yeah. Yeah, we call a regional center for people with IDD in most states, it usually means a facility.
Right.
But in this case, in California, I think they're like 21 in the state, I think.
Something like that.
Yeah,
Yep.
and that's really kind of the oversight body for different regions in the state, and really all focused on community supports and services.
Exactly. So it's in California, the difference is that services for people with intellectual disabilities are an entitlement in California, whereas that's not true in any other state. And the regional centers are sort of the way that entitlement gets distributed.
Gotcha.
So they diagnose, they provide program plans, and then they contract with vendors to provide those supports.
So you said you're co-located with the regional center, so
Yes.
you really interact with them.
Yes. And I think it helps draw people to the health center too who have disabilities because they know that setting and they're comfortable there. And it allows us to communicate with the folks who are creating those service plans. And in really difficult situations where people are not getting the services they need, we can kind of call everybody together and talk through as a team what needs to happen.
You know, that's such an important approach for everyone, really, to have an integrated team approach. And I think medicine is moving towards that in a lot of ways. But I've always, said that it's especially important for people with intellectual and developmental disabilities, including having, mental health and medical care and really dental care all put together, because there's so much overlap in what we see.
Yeah.
And if we're only looking at it through the medical lens or the mental health lens, they always say, if you want to have surgery, go see a surgeon, right?
Yep.
So if you want to have a tooth pulled, go see a dentist. If but we need to, Sorry, dentist. I didn't mean it to sound quite like that. But it, the idea is that we need to bring all of our areas of expertise together, and we can, I think, have a much better understanding and provide better healthcare.
Yeah, I agree.
Yeah. So what? How many? Or do you have other healthcare providers that work in the clinic? I'm assuming.
We do, yes.
So how do you find them? Do you find people with experience?
Usually not.
Okay.
No. So we're finding people who are willing. And I think that's the most important thing, right? Like,
You're right.
I'm not scared, or I'm a little nervous, but can you help me? We can work with anybody who's in that frame of mind. And the nice thing about our health center is, because we see people with disabilities, and not about 35% of our patients have intellectual or developmental disability, you get enough that you learn quickly, but I can kind of ease people in because we have sort of more traditional FQHC patients as well. So you can kind of build their skills over time, which is helpful.
Yeah. So do you have people that come from far away? Yeah. And
Yeah.
all right. So you and I know the answer to this, but why?
Yeah, because the most common thing new patients say to me is, I keep getting told they can't take care of people like me.
Yeah.
Which is crazy. It's
terrible.
just awful to hear. And I hear it over and over again. There's so much really just discrimination still for people with disabilities in healthcare. There was that big New York Times study that came out, talked about the New York Times, about healthcare providers' attitudes toward taking care of people with disabilities. And our patients feel that.
Yeah.
So they feel welcome, and because they feel welcome, they come a long way.
Yeah. And, to me, the goal, and I say this all the time, any patient with any level of disability or no disability should be able to, present themselves to any healthcare provider, any hospital, and receive at least a basic level of competent and compassionate healthcare.
Yeah.
And that does not exist today for many people with IDD. And my thing is that I think it has a lot to do with education. You know, I say this too. I'm a family physician. If you come to see me for cataract surgery, you're going to have a poor outcome. I'll probably refuse to see you. And if you make me see you, it's not going to go well and you'll go blind, because I'm not trained to do it. Not because I don't care, not because I don't, want to provide good care for people. But if I'm not comfortable doing something, I'm going to say, no, I'm the wrong person. You need to go somewhere else. Right. And that shouldn't happen, in my opinion, for primary care for anyone, especially people with intellectual and developmental disabilities.
But you also wouldn't say, like, sorry, I'm not going to see you. You would assess what's happening with this person and connect them with the resources that they need. And that's our responsibility.
Yeah. So, Michelle, we've talked about a lot about what the clinic does, what you do there. What's the future of the clinic like? What's happening? Where are you moving towards?
Yeah, this is a really exciting time for Achievable. We, to our great honor and surprise, received a large grant from the Mackenzie Scott Foundation recently to help us expand. So we're planning to more than double our size beginning in the fall. We got to design the space, which is really exciting to think about how do we make this space feel welcoming and accessible to everybody. And so really looking forward to that opening in the fall, being able to serve more than twice as many people. It's really...
I guess you're going to probably have to hire some more clinicians.
Yes,
as well,
exactly.
Too,
huh? So that's exciting too. Anybody interested, let us know.
And honestly, that's one of the reasons I do this podcast. It's to help people understand this field a little bit better and understand that they can have a wonderfully fulfilling and rewarding career in this field. It's a fantastic field to work in.
Yeah, I think a lot of us go into medicine because we want to feel useful and helpful, and it is just so easy to be useful with some basic skills. You're serving a group of people who really deserve great quality healthcare, and you can do it. Yeah. It's what I always tell medical students when I work with them. Be brave, and you can do this.
You can do it.
You have the skills.
Yep. And it's the skills, and if you've got support behind you, helping you along the way, for sure. So you've probably mentored a lot of people over the years as you've done this, and educated a lot of people in this field too, which is great.
Yeah, I don't think about it that way because it's part of our everyday work, but it adds up.
Yeah.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, my ability is stronger than my disability. We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support.
So it's 3 and 3 time. Okay. So it's 3 things in about 3 minutes that you would like the audience to know about really anything related to supports and services or healthcare for people with IDD. What do you think that, what would you like to share that can improve the world?
I think some overlooked things, maybe social connection is so important, and so many people with disabilities feel isolated. And so anything we can do to help people feel connected and part of the social fabric of society really am talking about revolutionary change in society, I think. But that's
good. That
really important for people. I would say besides, they said they can't take care of people like me here. It's I really want a girlfriend is the second most common chief complaint.
Interesting.
Like people are just really wanting more social connection.
Well, we are social creatures, and we thrive on interaction with others, and that has not always been very available for people with IDD. So I get that.
Right. Yeah. So I think that.
So number one, improve inclusion and
social connectedness, and I think there's data that it's a health risk being socially isolated. And COVID really exacerbated that or highlighted that, I think, for me. So that's an area.
Yeah, you're right about that. And I'm going to jump in just for a second and talk about that. You said it's a risk. It's a health risk. And that would fall into the social determinants of health. And that's something we're hearing so much more about in general medicine, but also in intellectual and developmental disability healthcare. Because our life circumstances affect our health in a lot of ways: connection, transportation, access to healthcare, access to good food, being able to live in a safe environment. All of those things have a huge impact. So it just fits right in with that.
Second, I've kind of already said this, but I think because healthcare is a human right, if you have that mindset, then you need to take the steps that you need to elevate your game in caring for people with intellectual and developmental disabilities. They don't really need a special place. They don't really need, they should not achieve. I love my work and I want it to continue for a long, long time, but we shouldn't have to exist. People should be able to get excellent health care wherever they go. I often ask people to do this mental exercise, which is to imagine the exam table at their doctor's office and to think about all the people they know who cannot access that exam table, which is a long list of people when I think about it, especially if you're imagining this sort of narrow, you have to take a step up and turn to be able to access that exam table. Many, many, many of our patients have not had a physical exam in years. And I don't understand how it's legal to have exam tables that people can't access, to have healthcare facilities where you can't weigh many people. These are simple things that would have a huge impact.
Physical accessibility is a big part of it.
You'd think we were past
you would think. What is it, the 30th anniversary of ADA, and now they're strengthening it with some new rules on things like physical accessibility. Like you said, you think we'd be beyond that. You got a third?
Maybe I will do two together.
That works.
It's a cheat. It's a little bit of a cheat. We already talked about this too. I think behavior is communication, and humility is really important from a provider. It's probably the most important skill, is to not look at somebody and decide what is happening, but to really gather all the information that's available to you and consider what they're telling you.
Or to look at somebody and make a judgment on their quality of life and say, they don't really deserve the best medical care because they're probably not going to live that long, or they won't know the difference. And unfortunately, that still exists.
I forget that still exists.
It does. It does.
When you're kind of immersed in it, it's so clear that there's vibrancy and joy and in all of our patients. And so you forget that mindset is still out there.
Unfortunately, there was a study that showed that recently that you mentioned earlier when we were talking. So, Michelle, thank you so much for taking the time to talk with me today, but more importantly, for the incredible work that you're doing in this field. And keep up the good work. I can't wait to hear more about the expansion. And again, just keep doing what you're doing.
You too, Craig. I have been a beneficiary of your hard work at Intellectability. The course you created, I think, is really smart, simple, gives people the skills they need to be able to feel confident that they can care for people with disabilities, which is just so really needed. So thank you.
Well, thank you for that. I didn't ask for that plug, but I will say, if you want to learn more, you can visit us at replacingrisk.com and learn more about that course and a lot of other services that we have. Thanks again, Michelle.
Thank you.